efficiency of white blood cells. It reflects a low white blood cell count. By the time we finish today, your vocabulary will have expanded tremendously. Okay? So, there are lots of causes for leukopenia. Okay? For instance, chemotherapeutic agents, medications used to treat cancer, can often lead to leukopenia. Why? Well, because these agents target rapidly dividing malignant cells. What are the cells in the body divide rapidly? Cells in the bone marrow. So they become secondary, they become bystanders that are, part of the casualties of war. So that chemotherapeutic agent can not only target the neoplastic cells, but also have some collateral damage and destroy some of those rapidly dividing bone marrow cells. And that can lead to leukopenia. Some viral infections, we said viruses typically cause an increase in percentage of lymphocytes, and that's true. But a severe viral infection like the influenza can knock down your entire white blood count, so that you can have a leukopenia, and even though there's an increased percentage of lymphocytes, the overall white blood count is decreased. So you'll have a low white blood count with a higher percentage of lymphocytes than is typical. Leukocytosis, on the other hand, refers to an elevated white blood count. I've already mentioned that we can see that with acute bacterial infections or inflammatory reactions. Like if someone had a third-degree burn that covered a lot of their body, a lot of their skin, or inflammatory reactions can be brought about by tissue destruction, necrosis, like we see with an MI. What is an MI? A myocardial infarction. That's when you have a heart attack. So it's not uncommon someone comes in with a heart attack, their white blood count might be slightly elevated, because that tissue death brings about a mild inflammatory reaction. CTD stands for connective tissue diseases. These are systemic diseases mediated by the immune system, like lupus. And there's a bunch of them whose names you haven't heard of. Okay. Polymyositis.
What does it stand for again?
Connective tissue diseases.
Thank you.
And then you can also see an elevation in white blood count with leukemia. But leukemia would be analogous to polycythemia vera. It's a malignancy of white blood cells where they're dividing out of control. The regulation is no longer there. Usually with leukemia, the white blood count is sky high, much higher than it would be with A or B. You could have over 100,000 white blood count instead of being up to 10.8. Woo! That was a lot of stuff.